Hello everyone, and thank you for watching this presentation. My name is Sherly Meilianti, and I am a lecturer in pharmacy at Robert Gordon University in Aberdeen, Scotland. Today, I will be presenting Breaking the One-Size-Fits-All Trap in MPharm Education through an escape room approach. This is a collaborative project that I led with Dr. Silvia Mazzotta and Dr. Betty Dube, who are also lecturers here at Robert Gordon University. In this project, we use an escape room activity to help our third-year MPharm students to connect public health, equity, diversity, inclusivity, and sustainability in a more active and applied way. The phrase one size fits all is central to this project. In healthcare education, students often learn that services should be fair and accessible. But in practice, a service can look fair on paper, but can still exclude the people who needs the most. For example, a community pharmacy may offer free blood pressure checks to identify people at risk of high blood pressure. On paper, this sounds fair because anyone can walk in. But if the service is only promoted inside the pharmacy, offered mainly during working hours, and explained using complex written information, this service may miss some of the people who could benefit most. So our aim was to help students to move beyond simply asking, is this service available? And instead, they need to ask, who might still be excluded? And how can we design the service differently? So in this project, we wanted students to think about what would make the healthcare service equitable, realistic, and also sustainable in practice. These are the outlines of our presentation today. I will give you some context and background about the module, which is Global Citizenship in Healthcare module. Then I will explain the gap that we identified from students. After that, I will show how we designed the escape room, how the stations work, and how the puzzles connected to the assessment. I will then share some of our evaluation findings from students' feedback. And I will finish with some practical design tips and the changes that we would make next time. So if you are interested in using escape rooms, gamification, or active learning to support assessment preparations, I hope these sessions gives you an idea that are practical and adaptable. As I mentioned earlier, the escape room was designed for a third-year MPharm module called Global Citizenship in Healthcare. This module aims to support students to develop their cultural competency. It focuses on their knowledge, skills, and values that is needed to reduce health inequalities, to care for people from diverse cultures and communities, and also to contribute positively to the planet and the profession. Future pharmacies will not only supply medicines or provide clinical advice, they also need to design, deliver, and also evaluate services for diverse communities. But sometimes this can be a particularly difficult point to teach because they may understand each topic separately. They may understand public health in one session, equality, diversity, and inclusivity in another session, and sustainability in another session. So the challenge is to help them to see how this topic connect to each other when they are designing a real service. That was the starting point for this escape room. We wanted to create a learning activity that helps students to join the dot. So in this slide, I would like to give a brief background about the assessment. So the module assessment asks students to develop a pharmacy-led equitable healthcare service for an identified population aligned to an allocated sustainable development goals. So we have selected 6 development goals in which the students need to develop a group project aligned with one of these 6 sustainable development goals. They will present the project as a 15 minutes group presentation, and then this will follow by individual questions. Each student will answer 2 questions, and they can be asked about any part of the group proposal. This is important. It means that students cannot only understand their own section of the presentation, they need to understand the whole service because they will need to explain why the service is needed, who is it for, what the service will do, and how public health, equality, diversity, and inclusivity, and also sustainability inform the service, and how the service will be communicated and evaluated. So the assessment is not only asking students to describe their service, but it is asking them to justify their choices. So why they select this population, why they conducted this service, how they will reach to the population, and why what would be the outcome and why this will be the outcomes of their service, and how will this service reduce rather than widen the health inequalities. So that's the idea about the assessment. The escape room was designed to help students to practice these kinds of thinkings before the assessment. For developing the activity, we look carefully at historical student feedback for this module. Last year feedback showed that some students were unsure about the connection between the talk contents and assessment. Some of them also unsure about the importance of the module because the concepts sometimes can feel broad and also abstract. And there was no refresher session as well last year. So this year, the beginning of the semester, we asked the students whether they will value a gamification to support their learning. And 53 students, which is around 38% of our cohort, stated that gamification would help in their learning. And some of them also expressed worried about the group work and group projects itself as well. In the mid-semester, before we conducted our escape room, we also gathered some feedback, and some of them still saying that they need support in identifying connection between the project sections, and they also need for more active learning. So from all of this, we know that we need to do something to help and tackling this gap, and that is why we choose an escape room approach. Not because we wanted to add a game for the sake of it, but because the format gave us a way to make assessment thinking active, collaborative, and also memorable. When we designed the escape room, we used four main principles. The first principle was applied. We wanted students to move from definition to decisions. Instead of only asking what does equity mean, we wanted them to design how a service should change if some people face a greater barriers to access. The second principle was integrated. Public health, equality, diversity, inclusivity, and sustainability were not treated as a separate topics. In real practice, these areas actually interact to each other. A service may be efficient but not inclusive. A service may be sustainable but harder for some patients to use. So students needed to see those connections. The third principle was collaborative. Students worked in a team so they could discuss ideas, challenge some assumptions that they have, and hear different perspectives. And the fourth principle was low cost. We wanted the activity to be realistic for teaching teams to deliver. So the stations used simple printed materials, cards, clues, and low-cost resources. The aim was to create something engaging without needing expensive technology or specialist equipment. For us, this was an important design message. The escape room was not an extra activity added onto this module. It was a structured way to help students practice the reasoning they would need for their assessment and also for their future professional practice. So the phrase that we used for the design of our escape room was revision as applied judgment. What really drove the design was a desire to provide students with a revision opportunity as applied judgment. What does this mean? Well, in many revision sessions, students are asked to remember information, which is useful, but sometimes that can be quite passive. So in our escape room, we wanted students to do more than just remember. We wanted them to make decisions. Uh, in this escape room, they use a talk content, discuss ideas as a team, work under time pressure, and created outputs linked to a service proposal. So this changed the nature of revision. So instead of asking, do you remember this concept? We wanted students to ask, what should we do with this concept? How does this affect our service? What would we choose and why? So that is where a true learning really happened. This escape room format created energy, urgency, and also curiosity. But the real educational value was in the decision that students had to make and the justifications that they had to give. And of course, it also make the revision session more enjoyable as well. I will now pass the rest of the presentations to my colleague, Dr. Silvia Mazzotta, to talk to you about the escape room overview.
The escape room was delivered as a 75-minute activity. Students worked in teams of 5 and moved through 7 linked stations. At each station, they solved a task, selected or sequenced information, and rebuilt one part of a pharmacy-led equitable service proposal. By the end of the activity, each team had worked through the full logic of a service proposal. The important point is that the stations were linked. This was not 7 unrelated puzzles. It was a journey for the students, which we will further describe in the next slide. This slide shows the 7 stations and how they mapped onto the assessment. Station 1 focused on identifying the health need, which is linked to the why of the service. Station 2 focused on prioritizing the population, which is linked to the who. Station 3 focused on designing the service pathway, linked to the what. Station 4 focused on public health logic, 5 on EDI barriers, and 6 on sustainability. And finally, Station 7 focused on the campaign and outcomes. Now, this was deliberate. The assessment asks students to explain the why, the who, the what, the how, and the here of their pharmacy-led service. So we designed the escape room to follow the same structure. But instead of presenting this as an assessment checklist, we turned it into a problem-solving journey. This helped students see that a good service proposal is not built from separate sections. It is instead built from connected decisions, and each decision affects the next one. For example, the population you choose affects the pathway that you design, which in turn affects the access barriers you need to address, which in turn affect the campaign you create, and so on and so forth. So that connection was exactly what we wanted students to experience. Each station followed a simple pattern: evidence, decision, and justification. So first, students had to look at the evidence, and this may be a short scenario, a data point, a patient perspective. Then they had to make a decision. So they might have to prioritize, match, sequence, exclude, etc. And finally, they had to justify their choice. And this final step is really, really essential. We did not only want students to find the correct answer, we wanted them to explain why that answer made sense. A useful design question for us was, what would change if this patient group had lower access, lower health literacy, or a higher environmental burden? That question helped keep the puzzles focused on equity, and it stopped the activity becoming only a memory test. For example, if a puzzle only asks students to match a term to a definition, although they may find that enjoyable, it may not help them prepare for service design. But if a puzzle asks students to choose the most appropriate pathway for a population with a specific barrier, then students have to think more deeply. So the puzzles were designed to make students think like future healthcare professionals, not just like students revising content. So this slide shows one example from the activity. This is the Watt station. The station focused on the service itself, and this is because in the assessment, students have to describe what their pharmacy-led service will deliver. So how will it work in practice, what the intended outputs and outcomes are, and how the service could be evaluated. So in this station, we asked students to build the logic of a service pathway. So students were given 6 pathway elements which were visible, as you can see in the first panel in the slide. And then students had to use a UV pen to reveal a hidden clue. So once they revealed that hidden clue, the sequence of letters they revealed would make the word service. So the final answer was simple and memorable, but the learning was really in the process here. So we wanted students to think carefully about what needs to happen first in a service. So for example, how do people reach the service? What inputs are essential? What happens at first contact? What follow-up or onward pathway is needed? And so on and so forth. Using the UV pen obviously created curiosity and gave the puzzle an escape room feel, but the educational purpose here was to help students see what a service is like. So it's not just an idea. A service needs a clear route, the right resources, a first contact process, follow-up, measurable outputs, and intended outcomes. So this station was a good example of our overall design approach, with the puzzle being playful, but the thinking being professional. After the escape room, we gathered student feedback to evaluate levels of engagement and perceived learning value. Out of the 59 students who took part in the activity, 36 students completed the feedback, giving us a response rate of 61.1%. The feedback included agreement ratings and free text comments and was outstandingly positive, as we will see in the next slide. However, it is important to highlight that while students clearly perceived the activity as enjoyable, active, and useful for reviewing key assessment concepts, we can't really say if engagement with the activity improved their performance during assessment. We feel that this needs to be highlighted here. So what was the feedback? So 94.4% of respondents agreed or strongly agreed that the activity was enjoyable. 97.2% told us that it encouraged more active thinking than a standard session. And 91.7% of respondents agreed or strongly agreed that it reviewed key assessment concepts and said that they would recommend similar game-based learning elsewhere in the program. What we found encouraging was that students did not only say the session was fun, they also recognized its learning value. They felt it encouraged active thinking, they felt it helped review the assessment concepts, and that was important because our goal was not simply to entertain them, our goal was to make revision more active, more connected, and more meaningful. The free text comments gave us more insight into why students valued the activity. Positive comments focused on critical thinking, teamwork, engagement, and inclusion. Students also described this activity as a great way to end the module, as it helped them recapping all the content and linking concepts. Overall, the activity seemed to achieve 3 main goals. It helped students think actively, it supported group discussion, and it helped students bring in together content from across the module. This combination was exactly what we were hoping for. So the students' comments were positive, but they also helped us identify how to improve the activity in future, for example, with regards to timing and instructions, which we will discuss in the next slide. So looking forward, there are aspects of the escape room that we are hoping to improve. For example, before the activity, we will show one worked example of how answers should be recorded. This would help students begin with more confidence, which we felt wasn't always the case in the recent first run of the activity. During the activity, we will help students keeping to time more proactively, and we will also be more proactive in giving teams small hints if they get stuck. This is something we have done this year, but we feel needs more structure and consistency going forward, with the aim being not to give away the answer, but to just keep the students moving on. After the activity, we will include a more structured debrief to make the link between the game and the students' assessment much more explicit. A post-activity reflection could also be used to help students reflect on the quality of their decisions, not just whether they completed the puzzle. Finally, we are hoping to strengthen the evaluation to be able to measure learning more directly. For example, we could compare students' confidence before and after the activity, or we could look at whether their explanations and justifications improve after completing the escape room. From developing and evaluating this activity, we identified 5 practical tips that we would like to share with anyone approaching escape room design for the first time. The first is start with the assessment. Design the puzzles around the thinking students need later. So for us, that meant designing the puzzles around service development, equity, and justification. The second is ask students to justify their choices. So we don't just want to know what the answer is, we want to know why is this the right choice. The third is include equity checks. So build in moments where students have to think about who might be left out. For example, does the service assume internet access or English language confidence? The fourth is talk through difficult choices. Sometimes there is no perfect answer. So for example, a service may be practical but less inclusive. It may be sustainable but harder for some people to access. And this is where the debrief becomes particularly important because it gives students time to talk through these decisions. The fifth is make instructions clear. This may sound basic, but it is essential. If the task wording is confusing, students spend their energy trying to understand the puzzle rather than thinking about the service. So our advice is to test the wording first, even with a colleague or a student helper. To conclude, this escape room was designed to help students move beyond one-size-fits-all thinking. It helped them connect public health, EDI, and sustainability, and apply those ideas to the design of a pharmacy-led equitable service. The activity was low cost, curriculum aligned, and linked directly to the assessment. Students responded positively, especially in relation to enjoyment, active thinking, and review of key assessment concepts. Our main message is that escape rooms do not need to be complicated or expensive. When they're carefully designed, they can help students practice professional judgment in a structured, memorable, and collaborative way. For us, the value of the escape room was not simply that students escaped the room. It was that they began to escape one-size-fits-all thinking. Thank you very much for listening, and we would be very happy to hear from colleagues who are interested in adapting this approach, sharing ideas, or exploring similar active learning designs in healthcare education. Please feel free to contact us using the email address shown on the slide. Thanks again, and bye for now.